International Modern Hospital Superheroes. Only on 105.4 Radio Spice. Full to twisted.
So doctor, in UAE, firstly, what are the major issues that you see in kids?
See, UAE being supposed to be a clean and safe environment, here we face mainly issues which are recurrent allergic symptoms, and most likely because of the changing climate, we come across many viral illnesses. These are the more common illnesses or conditions which we come across in UAE.
You know, and asthma is something that is extremely common. Is there, I know we can't cure asthma, but is there something to do so that we can control it?
Yeah, as I previously said that viral illnesses we come across more frequently, and any viral illness is a trigger for asthma. And as you said correctly, we cannot cure asthma. Asthma is having its natural cause. Means most of the children after certain age, means after 7 or 8 years, usually the frequency disappears or asthma gets cured, and we can keep asthma episodes under control. There are two headings to control the asthma. First thing, we have to avoid the triggers which are causing acute symptoms. Like triggers in the form of maybe some child may be having some allergy to some certain foods. Those foods you have to avoid. And second thing, you have to avoid certain triggering factors which come through the inhalation, like dust, smoke, household dust, like some dust from some toys, some desert areas, some parks. If the child is allergic, mostly these are the triggering factors. So first thing in the control of asthma is avoid the triggering factors, and second thing, there are medications. Medications in the form of some tablets you have to take for 2 months, 3 months. There are some medicines available in inhaled forms, like you have to take in the form of inhalers. So these are also very good medicines to keep the asthma episodes under control. But these medicines you have to take for long term, like 2 months, 3 months course.
And also asthma, dust allergies are extremely interrelated.
Yes.
Dust allergy, is there something that the parent could do so as to sort of control their child's dust allergy?
Yeah, dust, you have to avoid household dust whenever you are, for example, in the house, you should go for wet mopping instead of dry mopping. Okay. That is one thing. All the like beddings and all the clothes, everything should be cotton. And if there are some beddings from where cotton is coming, you should cover with some plastics. These children should avoid the soft toys, because that is a common triggering factor.
And that's like the biggest part of their childhood.
Yeah, but they can have different toys.
Plastic.
Plastic. These toys are safe for them, because these soft toys they are carrying all these landers and triggering factors for the acute episodes of asthma. And definitely smoke should be avoided. Then outside, if they are going to certain parks, particularly when the climate is changing during the winter season, the pollen grains you must be knowing, these are the triggering factors for asthma. So such places should be avoided for such children.
And even carpet, would that be one?
Yeah, carpet also should be properly cleaned regularly.
Okay.
And another thing, for such children who are having frequent episodes of asthma, proper humidification has to be maintained. So they can consider using of a humidifier at home also.
Okay.
Humidifier plus air purifier.
Doctor, so I know you have a kid, and I'm sure you agree when I say, like, feeding them fruits and vegetables is like a huge task. So what can a parent do to increase fruits and vegetables intake in a child's diet?
See, every child is unique in his taste and his likings actually. But if you introduce all these foods at a proper place, proper time, when the child doesn't understand much, means particularly when you start semi-solid and solid foods, particularly around 6 or 7 months of age.
Okay.
From that time, if you start giving him all these kinds of vegetables, if he likes the taste at that moment, then it will be very easy to carry on. And most of the children are picky eaters. They don't sit at one place and they will finish their lunch or dinner at one place. Always they want to play. So they should see play in that food also. So you have to give in different formats. Same thing, if you repeat, the child may not like. Okay. And examples like you can give in the mash form. You can mix with other food which they are liking. Many children like fast food when the parents complain that child is not eating at home, but whenever he goes outside, he is eating good. So you can prepare those foods at your home also, and in that you can give some vegetables. You can add the vegetables.
Alright. A question which is extremely common for our listeners. They want to ask you that when they're traveling back home, India, Pakistan, Nepal, Sri Lanka, they have this issue that within 4 days their child falls ill. So they want to ask, is there any injection that they should take, their child should take, and should they boil water, and what else should they do?
Yeah, as in the beginning only I said that UAE being a safe and clean environment. Here, because of the clean and safe, there are less chances that the child are getting ill. So definitely those children who are going to Asian countries like India or Pakistan, definitely they come across lot of different types of pollution. Water pollution you can avoid definitely by boiling the water, using boiled water. We can tell the parents to avoid any outside food or home-based food, and all cooked foods they should consume, so that there will be less chances of gastrointestinal infections. But air pollution is the thing you cannot avoid in those places, because you know all these countries are very much crowded. So definitely there are some vaccines, particularly flu vaccine is very useful when you are traveling to such places when the climate is drastically changing. Like here it is hot and there can be winter or maybe rainy season. So flu vaccine is the one. Another vaccine I would suggest, that typhoid vaccine. That is very good for, because typhoid is a condition is very common in such countries.
Also, you know, when their kids fall in, when they get fever, a very spontaneous reaction is Calpol or Panadol. But these days, I've been reading that like fever should never be taken lightly, because you know fever can lead to a string of other illnesses.
Yeah, even for adults, but at least for children, I would say that self-medication should be definitely avoided. You can carry any antibiotic medicine with you, because in emergency situation you can start the medicine, but as early as possible you have to consult the doctor to find out the cause of the fever.
Okay, and this last question came in from a listener, Seema. Seema wanted to ask you that her child's fell from the staircase, and he's about 3 years old. He's got a couple of stitches like on his forehead. Now it's got a little mark, and she thinks it's bringing down his confidence level. So is there anything that he can do to, I don't know, to get rid of the mark?
See, there are some creams available for those scars. Anti-scar creams are available. Like I know one, that is Nebo company is having this anti-scar mark. But actually, they should start applying this in the early phase. Then it will help. But anyway, in any situation, it will take some time, because in our skin there is one pigment, that is melanin pigment, that gives the skin his own color. So whenever there is scratch, or particularly whenever the child has stitches, so there must be some dead skin like that. So it will take its own time to regenerate the skin. So they have to be patient for sufficient. It may take up to months also, like 6 to 8 months to regain the same color as the normal.
As long as it will go permanently, it will.
Definitely it will.
All right. Thank you, doctor. And would you suggest something for our parents, a tip for them to take care of their kids better? Any foods they should avoid completely? Any foods that boost the immunity?
Actually, there is no any restriction that any particular food should be avoided, but definitely if the child is having allergy to some particular food, like I said, in those children who are having skin allergy, eczema, or those children who are having allergic rhinitis, asthma, and if the parents have noticed that this child is particularly sensitive to such type of food, those food only should be avoided. Otherwise, there is no any contraindication that this child should not be, because there are many misconceptions like after eating banana child is get congestion or cough. It's not like that. Every child is unique in his own way. And for immunity boost, there are definitely some all vegetables, particularly green leafy vegetables, and all types of fruits. They are having all these antioxidants and minerals and vitamins. So definitely they are immunity boosters.
All right. Thank you so much, doctor.
Superheroes at International Modern Hospital, Bardubai. Call 04 406 3000.